clinics offering cosmetic procedures such as Botox will have to screen customers for mental health problems under new regulations. Staff are to be trained in spotting the signs of conditions such as body dysmorphic disorder, which causes people to obsess over perceived flaws in their appearance. But the safeguards will only apply to providers registered with the Joint Council for Cosmetics Procedures. Well, I'm joined now by Dr. Shirin Elite, aesthetic physician and founder of Elite Aesthetics. Thank you for coming in this afternoon. I mean, what do you make of these new regulations?
Well, first of all, I'd like to say that anything that goes towards improving patient safety in cosmetics is incredibly welcome. However, I think that because this is being introduced to members of the JCCP, it's not going to go far enough to actually make a big difference to the industry at the moment.
That is a real concern because, you know, unless you are affiliated to this organisation, it doesn't really matter. So, you know, you'll have people who will go to bodies that are outside of this organisation's remit because perhaps it's cheaper and there are other options available to them.
Well, yes, that is the situation at the moment. I personally believe that all cosmetic procedures are medical and should be carried out by medically trained professionals only who have their patient interests at heart. Unfortunately, the industry in the UK is not regulated and we have a wide range of people performing the procedures. It's all very well introducing more regulation to people who are already regulated, but what about the Wild West out there? What are you going to do to curb?
So what would you like to see done? I mean, how can that be changed and rectified?
Ideally, you'd want to see all aesthetic procedures to come under the realm of medicine and be a medical specialty so that you know that everyone providing them is properly trained, properly qualified, properly insured. However, the UK doesn't have the appetite to make it regulatory at the moment.
Why is that?
I'm not sure exactly why, but in terms of the government, they've said that all the registers should be voluntary, and in my opinion, that's not going to go far enough to protect the public.
I guess, you know, even with these regulations coming into place and the training that practitioners will receive, I mean, how do you judge when somebody has, you know, an interest in changing their appearance or is actually having or suffering from a mental health problem? It's quite difficult because a lot of that stuff manifests itself at home, say body dysmorphia. It's when you're at home looking at yourself in the mirror and saying, you know, I'm not big enough, or I'm not muscly enough, or I'm not slim enough.
So there is a difference between being unhappy with how you look and having body dysmorphia. Body dysmorphia is a mental health condition which about 1 in 50 people suffer from, and that is an excessive obsession with perceived flaws. They may not even be genuine flaws. As a medically trained professional, you do have some experience in diagnosing mental health conditions. So when people come to me, I perform an in-depth consultation. Not only do I look at their medical history and background of previous procedures, I also have a conversation with them about the reasons they are looking to have treatment. And there are certain red flags that come up in patients with body dysmorphia. So things like clinic hopping, having multiple procedures with multiple practitioners and never really being truly happy with the results is a red flag in my opinion. And somebody like that who'd come to my clinic, I would be referring on.
Where does the responsibility lie then? I mean, should it be with the practitioners? If you've got somebody who's coming to you time and time and again to get an update or a different procedure, there's clearly a problem there.
Absolutely, and I think that's the point of having medically trained professionals carrying out the procedures, because we have a responsibility to our patients, and we're taught from medical school to first do no harm, and the care of the patient is utmost. So I think if you've got trained practitioners, trained doctors, dentists, nurses carrying out these procedures, then you're more likely to pick up the problems. If you've got someone who's non-medical, their interest may be more in their income rather than the person presenting.
And I don't know how long you've been practicing for, but in the time that you've been practicing, I mean, have you seen an increase in people with mental health problems or people who suffer with body dysmorphia, for example?
Absolutely. I think with the availability of cosmetic procedures now, you're going to get more and more people with body dysmorphia approaching clinics and other practitioners. So there is definitely an increase that we're seeing in our clinics. I think we're predisposed to naturally see more people with body dysmorphia due to the nature of the work we do. And the responsibility to pick it up does lie with us.
And I guess there'll be questions about the availability of counselling services as well. That should come hand in hand with these procedures.
Unfortunately, the NHS doesn't have the finances to provide the range of counselling for all mental health conditions, not just body dysmorphia. But hopefully the move that was announced today with the NHS wanting us to screen more for mental health disorders will also enable more counselling facilities to become available.
But ultimately, you're saying that the regulations are a step in the direction, but they don't really go far enough for you?
Absolutely. Like with all the regulations that are coming into our industry at the moment, with them being voluntary, I don't think they go far enough. Unless you have mandatory regulation for all practitioners providing the treatments, I don't think you're going to make a difference, because it's fair enough saying to me, oh, you need to do a screening questionnaire or you need to look out for these disorders. But what about all the beauticians that are carrying out the procedures that A, won't have the training available to them, and B, aren't medically qualified to make the diagnoses?
OK, Dr. Lakhani, very interesting talking to you. Thank you for coming in this
Thank you very
afternoon.
much.
Thank you.
Thank you.